You know, my grandfather was World War II veteran, smoked five packs of cigarettes a day,
Yep.
heavy smoker, died when I was 3 years old. I remember when I was 3 years old looking at him, and he had oxygen to his mask, and I never got to know him. He died at 63 years of age. I met my wife. We were dating during COVID, long distance
Yep.
relationship, and we got married 2021. And I realized we have a young family. Had a couple, we have 3 kids, 3 and under. My stepdaughter Sydney, she's 12, so we have 4 kids. But I remember my wife having some fears, and what happened is she started having flashbacks. Her mom was a non-smoker, well-respected interior designer here in Columbus, Ohio, and died quickly of lung cancer.
Yep.
Back then, happened so fast, there wasn't the targeted treatments. And maybe I could ask you just 2 questions. One, what drew you to lung cancer out of all these diseases, and where has that evolved in the last 15, 20 years?
So it wasn't really lung cancer that I was attracted to originally.
Okay.
It was the mentor. Ron Natale was a lung cancer
The
person.
one who had such the good manners by the
and
bedside, yes.
he had that passion. And he was infectious. I got that passion because of him. And he
sense.
was so passionate and dedicated and I was so loyal. I wasn't going to walk away because people said it couldn't be fixed, but rather say, okay, it's our job to figure out how to fix it. And so he was the inspiration behind it. It wasn't that I was attracted to lung cancer. There's nothing about lung cancer that's attractive.
That
In
makes
fact,
sense.
Sadly, I mean, people still look at it like it's a self-inflicted disease, even though your mother-in-law was not self-inflicted. 10% of the patients are non-smokers. 50% of the people diagnosed today are former smokers or never smokers. They quit and they still got the disease. So it's not a self-inflicted disease. If anything, it's big tobacco who was at fault.
Right.
They learned how to get you addicted.
Yes.
So there was not that piece of it. I was attracted to the process. I also don't like people saying what I can't do or that it can't be done.
Yeah, the competitive drive.
That has never settled with me. If they say it can't be done, it's because we can't do it now. Doesn't mean we can't. So lung cancer, I was right there when I started, it was just when they were deciding that it was even treatable, that cisplatin and etoposide, 2 drugs that are now well known, could work, but the treatment was worse than the disease. And so there was a lot of arguments of should we treat them
Should we even treat
at that time. And I've been lucky enough to be part of all that transition to going from untreatable, treatment worse than the disease, why cancer doctors have such a bad reputation, to precision medicine and immune therapies that have now given patients hope. And I think we've even changed some of the way people look at lung cancer. They don't look at people as, you deserve that, kind of thing, because that's not true. And so I think that I've been very lucky to be a part of that for the last 30 years.